Thank you very much, Presiding Officer. Good afternoon, First Minister. What action is the Welsh Government taking to eliminate multi-year waits for NHS treatment?
Well, good afternoon to Dr Hussain. Llywyd, in the 6 months following publication of the planned care recovery programme, long waits in the Welsh NHS have fallen by 23%. That is the result of significant additional investment, expanded facilities, service reform, and most of all, the enormous effort of NHS staff themselves.
Thank you very much, First Minister. Of course, we all acknowledge the tremendous stress our NHS is currently under, but multi-year waits have been around since well before the pandemic, especially in orthopaedics. One of my constituents has been waiting for a total knee replacement since 2019. He has been waiting in agony for 3.5 years, and all the local health board can tell me is that the waiting list is over 4 years long, and that the patient should see his GP to manage the pain. First Minister, do you agree with me that it is totally unacceptable that patients should wait that long, or that secondary care should be placed these additional burdens on an already overstretched primary care sector? I remember raising similar questions during my first term in the Senate, and yet here we are nearly a decade later having the same old discussion about orthopaedics. First Minister, when will Welsh patients finally get the service they deserve?
Well, Llywyd, I don't accept the general picture that the member points of this being a condition that has always been a problem in the Welsh NHS. Waiting times in the Welsh NHS had been falling for 4 and 5 years in a row up until March of 2019 and beyond. It is the impact of the pandemic that has built up those lengthy waiting lists in every part of the United Kingdom. As I said in my original answer, long waits, the longest waits in the Welsh NHS, fell by 23% between the end of March and the end of October of last year, and that includes gains in orthopaedics, which is one of the most difficult specialities to see a way of resolving the backlog and increasing activity because of the impact that COVID continues to have in the way that operating theatres and other procedures are carried out in the Welsh NHS. Of course, we want to see those waits brought down further, while people are waiting, I think there is a role for primary care clinicians in helping people to manage their conditions in the best way possible. In Swansea Bay particularly, the member will be aware that the Health Board is intending to concentrate planned orthopaedic care in the Neath Port Talbot Hospital, freeing up capacity at Morriston, retaining 10 beds in Morriston for the most complex cases, and in doing so, to have dedicated beds that will allow even more procedures to be resumed as fast as possible.